can we count on legislation to help us out of this? Welcome back to another episode of the Frustrated CEO podcast. My name is Patrick Lyons. I am just one of your three co-hosts, and this is the part of every show up until now where I have introduced my co-hosts, but I'm flying solo today. My colleagues that you know well by this point, Patsy Feeman, she and her family are in Belize. Can't wait to hear about that when she gets back. Our other co-host, Lev Tannenbaum, is in Hawaii at the moment. So he's unable to be here. I need a better vacation planner because I'm here and they're there. But anyway, I'm not alone. I'm flying without co-hosts, but I am here with a guest I am excited about because from the moment I met Chris Hamilton, I've known that he will help us cover a topic that frustrates our listeners. Right? This show is all about addressing the issues keeping CEOs awake at night. Chris can help us cover a topic that we're really just not qualified to cover ourselves. So let me introduce Chris. Chris Hamilton is a partner at Hotchkiss Insurance in Texas, where he leads the employee benefits consulting practice. Now, he specializes in managing healthcare and insurance costs to improve benefits coverage, reduce expenses, and enhance employee health outcomes. With over a decade of experience in corporate finance, Chris has advised clients across various industries, including private equity and oil and gas. And in his free time, Chris enjoys traveling, working out, attending live music events, and spending time with his family. Chris Hamilton, welcome to the Frustrated CEO podcast.
Thanks for having me. I'm excited for the conversation as well.
So just as a little teaser, there is actually so much to unpack here that as we were planning this, we decided up front that rather than give you, our listener, a monstrous marathon episode, we're going to break this into two different episodes, really covering one, a high level, and that's our conversation here, is a high level look at the insurance industry. How did we get here? Where might we be going? What's the impact on business overall? And then in our next episode, which you are going to want to make sure that you tune in for, in our next episode, we're going to get down into the specifics of what can I, as a business owner, do to help navigate through this chaos, right? How do I manage my costs? How do I deal with these frustrations? So, Chris, when you and I were planning, first question out of the gate, when you and I were planning this, I made a comment to you. I said, it almost feels like we should have been talking about this at the end of 2024, not the beginning of 2025, because open enrollment is over. And you were quick to say, that's actually not the case, that January is not exactly a horrible time to be talking about benefits. Tell us more.
So the first thought I have is not every company renews in January okay. 1. So we have clients that renew every month of the year, but the most common renewal date for companies is January 1. So most of the listeners, they've probably already renewed their health insurance. But what I typically find the best time to review and to plan is just after you've gone through a renewal process. And that's for a couple of reasons. One, the pain of that renewal is still present. A lot of the data that was used to generate that renewal, the options that were provided, it's all fresh. And so it allows an advisor to come in and do, I would just call it a postmortem of how the plan performed, what were the options that were presented, but most importantly, what are the strategies that you should have been looking at and considering that weren't even brought to the table. And so often the best time to start planning for the next year is at the start of the new year. And so that gives an advisor an opportunity to use relevant data to share their consulting work with you to show what you should be doing, putting together a longer term strategy. Most companies, when they go through a health insurance renewal, they're looking at it in a vacuum of a 12-month cycle. I get my renewal, I renew, and I cross my fingers and don't look at this until the next year. And hopefully the renewal is not too bad. But really, we find companies should be taking a more strategic approach and doing more long range planning, so 3 to 5 years. And the reason why you want to do that is because if you have a strategy and a roadmap of where you're trying to go, you're able to make decisions in that annual planning cycle that help you reach the goal. So for those reasons, we typically find just after a renewal is a great time to sit down with a client and do that long range planning exercise.
What's interesting about that is, first of all, it's counter to what I even thought when I asked the question, is this the right time you're going to be talking about it? But you talk about planning. Every listener, every CEO, every business owner, every founder understands the value of creating 3 to 5 year strategy. You're not just being busy every day and going wherever the business takes you. You're more intentional about putting a flag out there on the horizon and directing the business toward it. But I don't think they think of that when it comes to benefits. In fact, I think a lot of them, you correct me if I'm wrong, but I know a lot of the business owners who kind of hand that off to somebody else in the business to almost deal with, because they don't want to be involved in it and they don't see the strategic value of it. It's more of a pain in the rear end. It's like something we have to deal with.
Oh, yeah. And that's a common sentiment that I get. My primary market is dealing with CEOs, business owners, and CFOs. And oftentimes when I'm introduced to them, that's the feedback I get. It's not really something that I handle. I have somebody in my company, whether it's an HR leader or somebody else, that runs that process for me. And the conversation that I have with those CEOs is, this is probably the second or third largest item on your P&L. And it's growing faster than everything else in your P&L typically. So if you're a service-oriented business, it's typically second largest cost behind payroll. And if you're a manufacturer, it's second behind your materials, input costs, and then labor, then benefits expenses. And it's extracting value from your company. If you think about this line item that's going to grow at 10, 12, 15% compounded annual growth every single year, it might make sense to try to put a strategic plan to manage it. But the insurance market, the brokerage market, the insurance companies have conditioned us to believe that there's not really anything that you can do about it, when that in fact is not true.
Right.
And my experience in doing this over a decade is there are a lot of things that can be done. There's a lot of options that are out there, but the way the market's designed, they're not highly talked about. The exciting thing for me is a lot of the work that we're doing, it's picking up nationally. In fact, for mid-sized employers, some of the things that we're going to talk about are the fastest growing segment in health insurance for employer-sponsored coverage. So it's picking up traction. I travel the country every year teaching other advisors how to do the work that we're doing. And so it's picking up steam.
I mentioned at the start, we wanted to talk about how we got here and where we might be going. Feels like a huge mountain to climb, but how did we get here? How did we arrive at a place where the costs are rising exponentially? When you and I met a month ago to talk about recording these episodes, it was right after Brian Thompson, CEO of United Healthcare, had been brutally murdered. And there is, despite all the comments out there, there's never justification. It's tragic that that needs to be accountability for that. And yet I think what we've seen is people are angry. People are really angry about where we are today. How did we get here?
Yeah, there's a lot of friction with health insurance. And it's where expectations don't actually meet the experience that people have. You pay a lot of money. So if you think about this, the majority of Americans get their health insurance through their employer. So the employers are buying health insurance for their employees. They're paying a lot of money. Both companies pay the majority of health insurance premiums. Employees are picking up a substantial portion of it that, relative to their pay. That's just for the right to have health insurance. And then when they go to use it, they expect things to be covered, which is a reasonable expectation. And so when they have an experience where I need a medication or I need to have a procedure, my doctor's ordering something and the insurance company may decide to make somebody jump through hoops to get it or deny it or what have you, it creates a lot of frustration. You're seeing that now. I mean, go to any social media platform, and as that event you just described is being covered, look in the comment sections. And it's kind of sad to see that's the state of affairs that we're in. I think that's the primary driver behind it. Is it's expensive, it's confusing, and it doesn't work the way that many people expect or want it to work.
How did we get here? Like, how did we arrive at that?
Yeah. So I won't I won't belabor the point of the complete history of health insurance, but I mentioned employer-sponsored healthcare is where the majority of Americans that are covered get their health insurance. And that started back in the 40s. If you think about the Truman era, there were wage controls and exorbitantly high marginal tax rates. Employers couldn't pay somebody and didn't want to pay somebody more money to attract their talent, because the marginal value of those dollars was not going to be useful to those employees. It was going to get taxed. So what did they do? Simultaneously, the government gave a tax deduction, a tax break for employers for things like healthcare and retirement. So what you saw employers doing was providing healthcare, health insurance to their employees, and that became the standard. And so fast forward, I'm going to skip over a lot of events that happened. We get to this point in 2010 where the government wants to find a way to make healthcare more accessible and affordable, and the government passes the Affordable Care Act, also known as Obamacare or the ACA. It was well-intentioned, but there were some portions of that legislation that really misaligned the incentives of the market against the end goal that the government had to make health insurance more affordable. In fact, it did the opposite. So healthcare costs have continued to spiral upward, and thereby health insurance costs have spiraled upward. And people often ask the question about what's driving health insurance costs higher. There's a correlation between healthcare costs and health insurance costs. Health insurance is just one way that we pay for healthcare. You can pay with cash, you can use credit, but insurance is the primary way that we're paying for the majority of the healthcare that's consumed. So it makes sense. As the input cost rises, so is going to be the insurance. So healthcare costs have continued to spiral upward and upward and upward every single year. Healthcare and health insurance inflation is two of the most inflationary items in our economy. So let's dive into what's going on with healthcare. Look around the city that you're in, or if you're a listener, think about the city that you're in. 15, 20 years ago, there were a lot of hospitals in your local market. And today, after post ACA Affordable Care Act, what we've seen happen in every major metro area is hospitals have consolidated. Mm-hmm. So where you might have had 5 or 6, 7 hospitals, you now have 1 or 2 dominant hospital systems that have gone out and acquired the other hospital systems. So there was consolidation, but then there was vertical integration. Those hospitals needed patient volume. And so how do you get the patient volume? Well, you buy the people that refer patients to hospitals. That's doctors. And so you saw this vertical integration where these hospitals would buy physician groups and pull them in to be employees of the hospital system. It would be primary care and then specialists. So think about dermatology and orthopedics and oncology. They acquired all of those and they start building more hospitals. They become very big. And when you become the dominant player in a given market, you're the price setter, if you will. It's become somewhat of a monopoly. And that allowed those hospitals to have pricing power over an insurance company. Because for these insurance companies to compete, to have employers that want to buy their health insurance, you got to have the local hospital in the network. So hospitals now have pricing power over the insurance companies. And so that's an important dynamic to understand that really shifted as these hospitals consolidated and vertically integrated. So let's look at the health insurance side. It's much a similar story. Back 20 years ago, there were 15 or more health insurance companies. You had a huge selection of different companies you could buy insurance from. But fast forward to today, there are really 4 dominant health insurance companies nationally. They're names that everybody knows: Blue Cross, United Health, Cigna, and Aetna. And much the same that hospitals did, they consolidated, gobbled up all these other insurance companies. They became very large. But they also embarked on a vertical integration strategy. So now you see not only are these companies involved in health insurance, but they're also involved in the delivery of healthcare. And there's been a lot of talk recently, the last couple election cycles, a lot in the news cycles as well with Mark Cuban. He started his own pharmacy benefit manager. He's done a really good job of highlighting a lot of the misaligned incentives and conflicts that exist in pharmacy benefits. So pharmacy benefits is a component of your health insurance. It's the component that pays for your medications when you go to a pharmacy or you mail order them. Well, what these insurance companies have done is they bought and grew their own pharmacy benefit managers. It's a subsidiary of the insurance company. And they further integrated into specialty drug distribution and even into healthcare. In fact, United Healthcare, for example, is the largest employer of physicians nationally. They employ over 90,000 doctors nationally. They've gone into cities and bought major physician groups. And the reason why this is important to understand, so I'm going to back up to the ACA. In my opinion, one of the things that immediately out of the gate misalign the interest of an insurance company with an employer. We often think of the insurance companies having the same goal that we have, which is to lower the cost of health insurance. In fact, they have the opposite incentive. And there was a provision in the Affordable Care Act called the medical loss ratio rebate. And essentially what this provision says in the law is that health insurance companies have to pay, if you're considered a large employer, you got 50 or more employees, the insurance company has to spend at least 85 cents of every dollar in premium on our health care. That's pretty well intentioned. So think about this. We don't want the insurance companies to take our health insurance premiums and then just completely deny our care and not pay for things. And so they mandated that insurance companies have to pay 85% of every dollar they take in. If they don't, then they've got to give back that excess to the employers. If you're a CEO and a CFO of a publicly traded insurance company, essentially your profit margin is capped at 15%. If you make 16%, you've got to give that 1% back to your policyholders. Your job as a CEO is to maximize shareholder value. Do you want to make 15% of $1 million or 15% of $1 trillion? So the incentive out of the gate was not to lower health insurance costs or healthcare costs. It was quite the opposite. And because the profit margins are capped at the insurance company, all of these insurance companies are owned by a parent. So we'll take United Health, stay on that example. United Healthcare is owned by United Health Group. Well, United Health Group has other subsidiaries. Optum is one. That's the entity that owns their pharmacy benefits, their healthcare division, et cetera. So these companies take advantage of transfer pricing is the way I would describe it. When they go out and set the price of drugs, what insurance company is going to pay for medications, oftentimes they're inflated costs. So a medication, I'm just going to use a very generic example, a medication that might only cost $40, when a member goes to fill that medication at the pharmacy, they're going to be charged $50. And the claim is going to be paid by United Health at a $50 rate. But the medication really only costs $40. There's spread built into the cost of that claim, and that difference goes into the subsidiary's pocket. And so when you look at these insurance companies' financial statements, where they make most of their money is not at the insurance company level, it's at the subsidiary level, because the profit margins made by those subsidiaries are not regulated. In fact, if any of these companies, when you look at their statements, the majority of their income is driven in these subsidiaries. And it's a conflict of interest because we expect these insurance companies to be good stewards of our dollars. But in practice, when you look at the way they spend the money, it's very different than the way we would spend the money ourselves in our own company. This is why we really advocate for employers, particularly at the C-suite level, is how can you manage something that you don't measure? So anybody that's watching or listening to this, when was the last time you saw what your health insurance was buying? What they were paying for medications and surgeries, and then furthermore, understanding what is a fair price. So if I came to you today and said, I've got a 1998 Toyota Corolla I want to sell to you, it's $100,000. Would you buy that?
Probably not.
Probably not. You would be flabbergasted if I just shared examples of things that we see every single day of health insurance companies buying things that really should be $5,000 and they'll pay $50 for it. And the reason why that's important to understand, anybody that runs a business, if your cost of doing business rises, you're going to have to raise prices to your customers. And that's exactly what's happening. And when you think about, there's only 4 insurance companies, big commercial insurance companies that are out there. There's not a ton of competition. And really what they are is a middleman who is not managing your checkbook the same way you would if you had that checkbook in your hand. The same way you buy everything else in your company, whether it's labor or technology, you manage project costs, things of that nature. But health insurance is so expensive, and we've been trained to believe that it's complicated and we don't have a way to do or manage. We turn that checkbook over to somebody else for them to manage it for us. And by the way, they don't show us what they're buying and what they're paying, and we have no way to benchmark. We're told we have no way to benchmark what's a fair price. That's really where the opportunity lies to solve that problem.
That it's almost overwhelming when you think about how we got here and how tangled it is. It sounds like ACA was a big driver, well intended, but it's always in the application of it that I think people find the loopholes, right? Can we count on legislation to help us out of this? One of the things we often say, we do a lot of work with clients on organization culture. And so we're constantly reminding leaders that culture lives in the stories that people tell, right? That's the stories that people tell. And when you think about the stories that people tell about healthcare, their experiences. That ultimately becomes, right, that's the culture, that's the perception that our country has about their experiences and about the process and how challenging it or unfair it is. But when I think about one of the stories that people tell about our healthcare is, as bad as it is, at least it's not as bad as Canada, or it's not as bad as where you can wait for 5 months to see a doctor. Right? I don't even know if these stories are necessarily true.
They are.
If legislation had a big hand in getting us here, and we count on legislation to have a hand in getting us out.
Well, I think there's two ways to think about that question. Well, I guess the first question I would ask, can legislation get us out of this problem? And the answer is yes. Can we rely on that legislation to actually happen? To be determined. I think there's definitely a demand for it. You're seeing that now in recent news cycles with a new administration coming in. Love him or hate him, Trump is definitely focused on certain aspects of our industry that are broken. He caught a lot of flack in the presidential debate when was asked about how he would solve healthcare, and he said, "Well, I have concepts of a plan." And I understand somebody wanted him to get up and give a 5-point plan on how he was going to fix healthcare. But what he recognized in that moment, and as somebody in the industry, what I recognized is he understands that this problem is complex and it's not as easy as a 5-point solution. There's practical solutions, and then there's solutions that you can actually get passed and signed into law. And I think he's done a really good job of bringing people in, particularly around the healthcare side, into his administration or the proposed candidates. Dr. Marty McCary is a really good one. John Hopkins physician, staunch advocate for reform in healthcare, health, and health insurance. He deeply understands the problems that we're plagued with in the industry, and along with those misaligned incentives and conflicts of interest. So he's somebody that is in the right seat to be able to opine and weigh in on policy. I feel very positive about that appointment. To answer your question, I'm not quite sure that the legislation is going to get done to fix the problem, because it's going to be something that's very, very unpopular corporately. Right. But I'll just give you kind of my initial thought on what needs to happen at a very high level. Think about the Bell communication system back in the 80s. It was a monopoly. The government broke it up. And there's going to have to be some components of that reform enacted in health insurance, where health insurance companies shouldn't be able to profit. I'm against profit caps. I'm a free market guy, but we don't have free market capitalism in health insurance. It's not a free market. And so that needs to be addressed. There have been things that have been floated around about rebates on medications and, pharmacy reform. I mean, I think that's a good start. But I think when you look at the way these insurance companies are designed and they're built and where they monetize their policyholders, there's some definitely room to take action there.
A few minutes ago, you were talking about the lack of transparency. Is there a role that business plays in challenging and changing that? Or is that just the way it's set up? There's really not much that you can do.
Oh, there's a ton that you can do. So employers should be demanding transparency. And data is available if you design your plan properly, and if you're in a plan that will give you transparency. So depending on what state that you're in, if you're in a traditional fully insured plan, there's not a lot of transparency with those. There are ways to get access to your data. Not to get too technical, but there's claims warehouses out there where you can get access to some of your data. Where most of the data becomes available is for employers that move out of a traditional fully insured type plan. So we're big fans of partial self-funding, even for small employers. We have employers that are 25 employees that are able to do this in a very safe way, which I'm sure we'll get into in the second episode of what that looks like.
Absolutely.
But you get granular level detail of what prescriptions cost. You can benchmark those costs to determine, are we paying a fair price or are we getting ripped off? Mm-hmm. And the reason why that's important is because when you design a plan like that, you get to handpick the vendors that you work with. You want to work with Mark Cuban's pharmacy program and provide free medications to your employees. You have a way to do that. And you make it free because instead of paying $50 for a medication, you might only pay $3 for a medication. The company's going to be able to reduce the insurance costs, and you can actually give away the medication for free to your employees as an incentive. Go to the Walgreens and get your medication. It's $50. But if you go through Mark Cuban, it's free. And so it's taking the current traditional way that we've done insurance and turning it on its head. And you can do that with everything in your health insurance plan, whether you're talking about surgeries, having a baby, buying medications. If you design a plan properly, you can reduce the cost. And then by reducing the cost, you're able to provide a benefit to your employees that reduces their cost. So you start talking about stories. Think about the story that employees tell today. This is a very common thing that I hear from executives, and it's kind of a jaded point of view. And I understand why I hear this. We spend $1 million on health insurance and our employees don't expect and enjoy it. They don't value it. They complain about our health insurance. Well, let's think about the employee experience. In an average mid-sized employer, if somebody has a family of 4, they're probably paying $1,500 or more a month for health insurance. That's just for the right health insurance. Then they've got to pay out of pocket when they go get medications, have a surgery, deliver a baby, and that could be thousands of dollars additional out of their pocket. And sometimes they run through hoops that they've got to jump through, and there's some friction when they use the insurance. So in the employee's mind, the story they're telling is, this insurance isn't valuable. I still have to pay a ton of money.
Right.
I need to use it. So that's the story of one employer, but another employer that's actually solved the problem and they've designed a high-performance health plan. That employee that used to spend thousands of dollars out of pocket for their healthcare needs every year now is able to get all their healthcare at no cost out of their pocket. So it's free, essentially. Kind of taking that even a step further, the employer looks at that story and says, okay, now my employees see value in what we're doing, why we made these changes. But furthermore, when I'm looking at my P&L, this number has come down in cost and I'm able to provide a lot more to my employees at the same time. So it's really two different stories of how to do this, how to solve the problem. And I think that, kind of taking this, I would call it, we talk about conflicts of interest and misaligned incentives. The question I always get asked is, why is everybody not talking about this? Why are and I blame the brokerage community for that. And you're starting to see some changes. There's been some reform in our industry. But if you think about the way an insurance broker makes money, the typical way is commission. And the commission is based off of the premium that the employer pays. Think about like a real estate commission. The more that this sells for, the bigger my paycheck if I'm a traditional broker. Is my incentive really to get you lower costs and take a pay cut? Is one. The second piece to that is, if you look at the top 100 brokers in the United States, or really even the top 25, they're all publicly traded and private equity owned. And there's additional compensation that's provided to those organizations in the form of end of year, in the industry, it's called an override or a bonus. And those bonuses are based off of how much premium you have with a particular carrier and how much did it grow. So when you look at those really large national brokerages, the bonuses they're cashing, the bonus checks, they're 7 and 8 figure bonuses. And so if you're publicly traded or you're private equity owned, you're answering to these shareholders. They manage their business, their EBITDA margins by the quarter. Are they really going to cut their nose off to spite their face and move business out of this traditional market into something that doesn't pay bonuses? In my mind, it skews the judgment, maybe not of the individual advisor down at the field level who's meeting with an employer, but at the corporate level when they're setting policy of what types of options those advisors are allowed to show their clients. And you see this in the form of, if you want to ask a broker, who are your approved carriers, who's on your panel, and ask them how those carriers were selected. And oftentimes it's a limited panel of distribution because they want to maximize those bonuses. And I believe that's a conflict of interest, in my opinion.
It's a common truth in business, really in anything. Compensation drives behavior. So it's easy for us to sit on the outside and point, say that's not right, and it's not. But in that situation, there's very few of us where compensation doesn't drive behavior. Incentives drive behavior. We're all wired that way. So, and what you were describing earlier, where there's a way for me as a business owner to lower my costs, for me to make it a better experience for my employees, like that just almost seems, when I think about the stories that people tell, it almost seems like that's not possible. It's unbelievable. So I'm as anxious as I would hope a listener is who's listening to this episode to want to skip ahead to episode 2 and say, all right, okay, awesome, Chris, how do we do it? But before we do that, one of the things we're challenging CEOs all the time is to pay attention to trends. And so when you think about trends, what are the trends in this industry. And maybe it's recapping some of what you've already said, but what are the important trends that CEOs need to be aware of if they do want to get more involved and create an actual strategy, be more strategic, more intentional, more thoughtful? When we do strategic planning, we ask, what are the trends that are going on in the industry? What are the trends in your market? What are the trends that your competitors are, what are you seeing out there? That factors into the creation of trends. So what trends should a CEO be thinking about or paying attention to as they begin to wrestle with this question of how do I get more involved and how do I get this under control?
Yeah, I think that's a really great question. One trend that we're seeing right now, we talked about it, is access to data and transparency. So if you're a CEO and your CFO comes and meets with you, you're going over your budget and your year-to-date performance, and there's a line item that blows up, your first question is why? And oftentimes when I meet with companies and I ask them, they tell me about their experience in their renewal, and we got a 20 or 30% increase. I ask them why, and usually the answer is, well, we're not really sure. We just know that our claims were high. But in any other business setting, any other line item in our P&L, when we ask that question why, we expect somebody to be able to back it up with data. Okay, this project ran over. Why? Was it, did we underbid the job? Did we not allocate the right resources to it? You want to get it to the granular level so that you don't make the same mistake again. You can learn and move on and perform better in the future. So this trend to access to data and have transparency of that information. So if you're in a plan today that doesn't provide that, the first question we should ask our brokers or our advisors, what can I do about that? If I'm in a traditional fully insured plan, how can I get access to my data? And if you want access to more data, what options should I be looking at that will give me access to this data? It's kind of cliche, but hope and prayer is not a strategy. It's unfortunate, but there are going to be years where you actually get a pretty decent renewal, and there are going to be years where you get a bad one. It's a high increase. There are better ways to do this with data and understanding the market and creating a plan to help prevent those large increases. And the first step is getting access to your data and having transparency of what things cost and what they should cost. Mm-hmm. The second trend that we're seeing, there's been a number of new entrants into the market, new competitors to the traditional insurance companies. And some of them are in their infancy stage, but there are a handful of them out there that have been around for over a decade. And they're picking up more steam. They're challenging the status quo of the traditional insurance companies, and they're providing access to data. They're providing ways for employers to control their costs over a long period of time. Those are things that employers should be demanding and asking of their advisors to see. And if you're not seeing those, you should ask for them. I mentioned when we started the episode, employers are the biggest buyers of healthcare in the United States. You have more influence and control over that cost than you realize. And that's why it's so important, because oftentimes CEO, CFO, and an HR leader, they've got a legal question. Usually they're not trying to resolve a really complicated and expensive legal issue internally. They're going out and hiring an expert, an attorney with a specialty in this particular matter, to help guide them through that process. We do the same thing with our health insurance. We bring in a broker who's supposedly an expert in helping solve this. And oftentimes the response that I hear from clients when they hire me is, well, my broker's always told me there's nothing else, there's nothing we can do. And oftentimes when we take a second look at this, particularly immediately after their renewal, we uncover missed opportunities. And if that happens, oftentimes you're able to make changes to your plan during the middle of a year. It's not, even though you have a renewal that's for a 1 year period, most employers have the ability to make changes to those at any point in time during the year. In fact, most of the clients that I work with, if I meet with somebody after the first of the year when they've done their renewal, depending upon what the opportunity is, oftentimes those employers they'll make changes in the middle of the year. They won't wait till the next year. If the opportunity, if the proverbial juice is worth the squeeze, if I can show somebody how to save $500,000 or $1 million and you're a mid-sized employer, oftentimes they don't want to wait to capitalize on that. They're going to take action. Sure. I think those are really the two biggest trends that we're seeing right now. Just to kind of summarize it again, is access to data and transparency, and reviewing alternative options to what the big four carriers are providing.
Thank you. That's great. That dynamic between the business and the broker's responsive, there's really not a whole lot we can do about that. Does that go back to, there's really no incentive on the broker to provide that level of transparency? Should I trust my broker? I guess that's kind of the question. Like,
I'm highly skeptical of my industry. I'm just going to say that. I got into this industry because I realized how broken it was. You mentioned I spent over a decade in corporate finance. A lot of my clients are struggling with this issue. It led me into researching this industry and trying to figure out what's really driving it. And the more I uncovered, the more I didn't like. I thought this industry was, I know this industry is completely broken.
hmm,
And there are opportunities. I would summarize this up into two categories. One, I don't think there's a whole ton of incentive for brokers to solve this issue. If you've got a client, the MO and kind of the inertia is just to renew them, get them renewed, move on. But I also think there's a lack of expertise prevalent in our industry. There are some people who, it's just like in any profession, you have some attorneys that are really good and some that you wouldn't trust, or maybe they have a different specialty. So there are brokers that are specialists in the traditional fully insured markets, and there are brokers that are specialists in building high performance health plans. Just like with doctors, you probably wouldn't want a primary care surgeon or a primary care physician doing your brain surgery. You need somebody who's an expert in that.
right.
And so it's really understanding, just in any industry, there are people who have specialties and subspecialties in doing certain things. That's why it's so important to make sure that you're hiring the right advisors. And there's a process that I use and give to employers. In fact, I give it away for free on my website. If you want to figure out how should I go through a process to hire the right advisor, I've got a checklist on my site that I'm happy to give away to anybody that's interested in it. So it's a mind map, if you will, a model that I use if I was an employer, how I would go about hiring the right advisor depending upon your goals.
That's fantastic. Hold that thought. We will make sure at the end, we'll make sure to give that out so that the listener knows exactly where to go to get it and to learn more about you. This feels like a good place to pause or end part one of this conversation. Again, listener, we're going to dive into, with Chris's graciousness, your time, we're going to dig into now, okay, what do you do about it? Realize that utopia that you were talking about earlier. My word, not yours, but how do I lower my costs, create a better experience for my employees, lower their costs? It's all about, I would think it's about retention. It's about becoming an employer of choice and being more profitable. So before we do that, we end every episode with what we call the Let's Get Practical, which is a segment where, okay, so if a listener wants to start doing something, right? How do I do? So we don't just listen and learn, we're actually benefiting by doing. Chris, what are 2 or 3 suggestions you would have for what a CEO, a founder, a senior leader can do immediately to start addressing some of what we talked about today or capitalizing on what we talked about today?
Yeah. So the first thing a piece of advice that I would give is to get involved. Yep. Oftentimes, owners and CEOs don't want to get involved in health insurance. It's vitally important that you do. Now, not necessarily that you have to run the process or be involved from beginning to end, right? We understand that you've probably got a team of people who are responsible for doing this, but getting involved, and I would say there's really 2 points that you have to get involved in this. It's at the very beginning. So the way a process of working with an advisor should work is there's going to be kind of a due diligence process where you're understanding the goals and the vision of what the company is trying to accomplish with their plan. And the CEO being in that room is going to help set the guardrails of what that vision needs to look like and set the rules of the road. This is what we're going after. This is what we're trying to obtain. I think it's just vitally important that they get involved very early on. Often the HR leadership and CFO are the ones that are going to manage the health insurance piece. But having that CEO help set the vision of where they're going, HR leaders are unbelievably important. They're so valuable to our organizations. But when you think about their skill set, they're probably most, but not all. I've worked with some HR leaders that have a very deep background in finance, but for the most part, they don't have the requisite finance skills and understanding the different types of transactions. And so what often happens, unfortunately, is what might be the best solution for an employer to meet their goals and in line with their vision gets removed from the board before it ends up going to a CFO or a CEO for final approval. And so being able to get involved in the very beginning in that goal setting and strategy session, allowing your team to run the process with your advisor But the second most important place for that CEO to get involved is at the very end when the presentation is being made of this is the strategy. I'm not necessarily talking about this is the renewal option that you have and looking at the numbers on a spreadsheet. It's this is what I understood your goals and your vision to be, the problems that you're trying to solve. This is how you solve those particular problems. And that allows that CEO to see that vision and be able to communicate with their executive leadership team, whether this is in line or not and something that we should evaluate. I almost think that sometimes the team that's responsible for the day-to-day running of a health benefit plan, there's a fear that that they don't want to break something. They don't want to cause disruption. And having that CEO in there, having their buy-in can change everything. And that's where we have the most success, is getting a CEO to sit in that room and to contribute to that meeting. Not necessarily involved in the day-to-day and the back and forth that's involved in that process of setting the strategy, but at the beginning and the end. I think that's the most important piece of advice that I would give to a CEO.
All right, I'll add a couple that I took from our conversation. One, we led with right off the bat that actually now is a good time to be getting involved, even though renewal might be over. If you're one of those companies that renews at the end of the year or renews on January 1, now is still a good time. Well, to your point, Chris, the data is current and the process of renewal is fresh in your mind, right? So don't put this off for 12 months where you're going to have, or 9 months. Now it's still a great time. I liked when you were talking about just, I think, remembering the dynamic of the broker and the business, right? That you as the business owner, remember that your broker or your advisor works for you, and ask questions, and you have more, in your words, Chris, you have more influence than you realize. And then I think maybe the last thing, again, we touched on a little bit earlier, is maybe that's the challenge. If you really want something, if you want it to be different, then think about benefits management like you think about strategic or business management, right? You're constantly thinking 3 to 5 years out. And yet I know very few business owners who think about their benefits from maybe as a line item on their P&L or a standard, it's going to rise 10, 15%, but think about the management of it and be more strategic in managing this. It is a massive cost, and it probably deserves a level of focus and attention that running the rest of your business deserves as well.
Yeah. One closing point I would make, it is important to challenge our assumptions. We've been told this is the way that it is, and there's not much that we can do about it. And so many big problems have been solved in our society, and new businesses have been created because we challenged the possibility of what could be. We challenged our own assumptions. If you've ever seen an elephant at the circus, a big elephant, it's tied down with this little stake in the ground, and you think to yourself, there's no way that stake is going to hold that elephant. But the elephant doesn't challenge the stake. Why? Because when that elephant was a baby, they were tied to that same stake, and they weren't strong enough to pull it out of the ground. And so they've gone their entire life learning, I can't pull this stake. Well, don't challenge it anymore. And we've got to stop doing that, because there are opportunities in the market that are easy for employers to grab if they're just willing to challenge the status quo, challenge what they've been told, and ask the two questions. Why? Why is this happening? And what can I do? Or why not? Why is this not available to me? If you ask those two things and you challenge that, you're going to find something there.
All right. I'm excited to dig into episode 2. But before we leave this episode, Chris, you mentioned earlier like a checklist that a business owner can go through, a mind map to choose a broker. Where can they find that, and where can they learn more about you, Chris Hamilton?
Yeah. So I have a website, fixhealthinsurance.com. I've got 2 items that I give away to anybody that's interested in them. One is a playbook. I call it the Benefits Insider Playbook. So I created the Benefits Insider as an insider to the industry. These are the things that we do with our own health insurance plan. We expose the secrets that the insurance companies don't want you to know. And here's a conceptual strategy that you should be using as you're going through your strategy setting and planning. The second piece is that broker checklist. So if you're looking to hire a new advisor or new broker, these are the questions that you should be asking them. And I give some feedback on answers that you should be looking for based on what your goals are. So some brokers or some companies have a goal of lowering their health insurance costs and improving their benefits, or maybe they've got service related issues and they want to solve for that. Depending on what you need in your company, I have questions and answers you should be looking for to make sure that you're bringing in the right person.
If you're watching this on our YouTube channel, perhaps we can post links directly to that download. Same thing, if you're viewing us through LinkedIn, which is where if you're not following us on LinkedIn, you should be. Go out and do a search for the Lions Group or the Frustrated CEO Podcast, and you'll find us. And we can post links there as well. I know that this is valuable content for our listeners. And as I led with, I know these are issues that really keep our CEO listeners awake at night. Chris, thank you so much for helping us with even just part one. And thanks in advance for agreeing to come back for another episode in a little bit.
Well, thanks for having me. I appreciate it.
Of course, listener, thank you for sticking with us to the end of an episode, another episode of the Frustrated CEO Podcast. Big shout out to my colleagues who are not here, but will rejoin us again in the future. And we'll see you again next time on the Frustrated CEO Podcast.